A nursing home resident's feeding tube dislodged. Hi, I'm Brett Leitner. I'm an attorney with Parker Waichman. Let me tell you what happened. I was handling this case on behalf of a family who could no longer care for their mother at home. She was 89 years old, she had advanced dementia, and she could no longer do her activities of daily living by herself. The family had to place her in the nursing home. Eventually, this woman needed a feeding tube because she could no longer eat by herself or feed herself. So the doctors inserted what they call a PEG tube, which is a tube that goes in through the belly area, through the abdominal wall, and into her stomach. Now, it's very important to do certain things in order to maintain this tube to prevent risks such as infection. Number one is you must clean the area on the outside of the belly after every use in order to prevent infection on the outside of the body. You must also check what we call the patency, or check the placement of the feeding tube on the inside of the stomach to make sure that that feeding tube has not dislodged into the abdominal wall. Because if it does, and the feeding contents dislodge or go into the abdominal wall, that can cause a massive infection. What happened in my case? The feeding tube dislodged. It was our allegation that the nursing home caretakers did not check for the placement of the tube, and my client sustained a massive infection, what we call necrotizing fasciitis, of the abdominal wall, which is also called flesh-eating bacteria. Within 2 weeks, my client was dead. We were able to secure a very substantial recovery immediately prior to trial on behalf of this family. So why do I tell you this? Because if you're watching this video, chances are that you have concerns, or that you have a family member who's in a nursing home and you may have some questions. If so, call me, Brett Leitner at Parker Waichman. I handle these type of cases every single day, and I'd be happy to talk to you. Thank you for watching.